everybody, welcome back to my channel. I'm so glad that you decided to join me again. Another 5 weeks have passed by like lightning speed, and I'm proud to announce I now have 6 more months left in the program. Just got through doing my 5th rotation. I have 3 more required left and 1 elective. So let's jump into it. This month I was at Internal Medicine Outpatient with a twist. Okay guys, so the doctor I was with this time, he was a little different. He did internal medicine outpatient. He had his own office. He also practices functional medicine, so that's my twist, which involves, you know, changing the lifestyle factors that we always talk about in every disease state. Talking about eating right, exercising, vitamins, you name it. Which is perfect for people who don't want to take medicine, who's more of the naturalist, but they still want to get whatever problems they have under control. My doctor that I was with was the one that could see them, help them figure out a plan specific for their needs, and work with them on achieving that. So that was awesome. I got a chance to see another side of medicine. How about, like, for example, we had a guy come in. He had cysts all over his body. We checked him. His iodine was low, and replacing the iodine got rid of his symptoms. We thought it was cancer, but he has had this problem before, had it biopsy, and it was benign. And I thought that was cool. Like, wow. The way that we are taught in medical school, of course, is how does the patient present? What does the lab say? What is your differential? What's your diagnosis based on your clinical findings plus your labs, and then what do you treat it with? But working with him was a little bit different. He wasn't pushy. He didn't push his thoughts or his functional medicine side on me, so to speak, but he did teach me. That he said that, you know, most diseases or most chronic illnesses come from allergies, like food allergies, for example, celiac disease, or environmental factors, genetics, stress, diet, exercise, and other things. And it's true. And people control their hypertension by losing weight, and control their diabetes by losing weight, and control even cancer by taking the right supplements that their body was missing. Like, I learned way more biochemistry, way more genetics, way more getting down to the micro sizes than I thought that I was going to learn. This was one of the most different rotations that I have ever been on. The whole 6 months we've been doing this. So I was like, wow, I learned a lot. It opened my eyes, and I really liked this rotation because the doctor I was with in particular, he pushed me. And I mean that to say, not to say like all the other doctors didn't push me, but he had a different mindset. And so it was kind of like, you know, why are you doing this? Why are you thinking this way? Did you not think about this? Or what's wrong with this patient? Matter of fact, story time. So I actually went with him one weekend, which was my last weekend with him last Friday, and we went to the hospital. Turns out, not only does he do internal medicine outpatient and he does functional medicine, but he is also a hospitalist on the side on the weekends. And so one night I went with him to the hospital. He took me to the ER. He said that we have 2 admissions. Here's the information. Go see him, work him up, act like I'm not even here. Peace out. I was just like, you leaving me? Oh, wait, you're leaving me. And then I was like, no, I'm a boss. You know, I got this. It's like, all right, you trying to see what I'm made out of. All right, you trying to see if I can do this? Let's go. So I went to go see the patient. I went to go see 2 patients. I wrote them up. I did the HPI, did the whole note. Allergies, medications. You know, I went in form. And they call everything soap note form, but I just say HPI because that's how we learned it in school. It was HPI, medications, allergies, past medical history, family history, social history, review systems, physical exam, labs, and then assessment and treatment plan. And so I wrote all of that out by hand, y'all, by hand. Then I went to go see him, and I had it right. I had my diagnosis right. I had my labs right. But he is very detail oriented, which is great because in medicine you don't want to make a mistake. We make mistakes, but they're preventable if you take your time. If you consult with your associates, your medical, your colleagues, and you discuss patients if you're unsure, but they are preventable. And that's what he was teaching me. And no other preceptor took their time with me enough to say, you know, why, to question me, to challenge me. And I needed that, and it has opened my eyes and changed the way I think. Not that the way I was thinking was different from before. It was, as far as assessment wise, but I feel like the things and the tools that I took from him will be things that I implement within myself when I go see my patients in my practice after I graduate, after I pass my boards, and from here on out. Because we had a patient, he gave me a scenario with a patient that had PE, and it's good to be detail oriented. I mean, duh, but it's good to be very, very detail oriented and look under everything with a magnifying glass. Excuse me, magnifying glass. I don't know where I was going with microphone. Anyway, because you always want to make sure you look at past medical records. You always want to make sure you look at current symptoms. You ordered labs. You compare them to previous labs. Same thing with EKGs. I'm pretty sure y'all heard this 1,000 times in didactic year. Still applies. And it's so easy as a student to get caught up in doing this testing, trying to pass. But this rotation in particular is very special for me because I got slapped back into reality. You're dealing with people. You're dealing with somebody's loved one. You're dealing with somebody's husband, somebody's wife, somebody's child, somebody's grandchild, somebody's grandma, somebody's niece. Now you get the picture. You're dealing with people. And everybody's sensitive when it's their family member, but you got to keep that same energy when you're dealing with other people. And the fact that he left me in the ER to see and care for these two patients and came back and checked on me like 2 hours later to make sure I didn't miss anything, that slapped me into shape. Like, I started looking up everything. I started practicing evidence-based medicine, which came into play, which we went over 1,000 times in didactic year. I started looking up articles. I started to consult with other PAs who were already certified in the building. I'm like, so I think they have respiratory alkalosis. They're hypokalemic. And I learned, hypokalemic, you want to check albumin and you want to check protein because calcium binds to the protein. And so if the albumin is low, then you can actually fix it. But if not, then it could be a true hypocalcemia. And then what do you do? And so I was actually put in a spot where I was uncomfortable. But I learned that being in medicine, watching Grey's Anatomy, watching Cold Black, yeah, all that, they make it as realistic as they can, but it's true. The moment you start feeling confident is the moment you're going to make a mistake, because medicine changes every day, and even the doctors who've been practicing for 30 years don't know everything. You will never know everything. You will always be a student even after you pass your boards and start practicing for years, because you're always going to be learning, and there's always something you can learn from someone else. So I basically just gave y'all my overview, what I learned. I gave y'all some real life stuff. Let's see. I'm all over the place. I didn't use any special books for this rotation. If y'all remember, back in February, I had my Internal Medicine Inpatient, and I showed y'all books and stuff. I basically used the same thing minus that case files book for outpatient, because it's kind of the same, like internal medicine, inpatient or outpatient, and family medicine kind of all mushed together in our program. As far as the testing questions went, they were kind of similar. Heart failure, hypertension, diabetes, the chronic stuff that we treat and see, and some of the stuff that you might see in the hospital that they be treated for, etc., etc. So I thoroughly enjoyed and learned a lot from the doctor that I was with, and I really appreciate having the rotation. It was not easy at first. At first I was kind of questionable as far as our personalities went, or as far as him as a person went, but needless to say, sometimes those be the people that you learn the most from, and I am so thankful. So yeah, if you notice a difference in my videos, I have a new camera. I have a Sony A5100, which is a smaller camera than my Canon, because I'm a photographer on the side and I take pictures, and the Canon was giving me trouble. You'll notice sometimes in my videos the camera will cut off and then I'll come back saying something else and I'll be all lost. So that won't be happening anymore, because now I have the camera when the screen flips up. So hey y'all, watch out now. I done upgraded to a Sony, but I still got my Canon because that's still my photography picture, but I won't be using it for video anymore. So I'm excited, I'm growing, I'm learning. As far as me as a person, I passed my OSCE today, which is kind of like my role play clinical. You get somebody on staff to play your patient. My medical director actually was the one grading me today and recording me today, and I'm so proud of myself. I passed. He saw a big difference in me than before, and I'm seeing a big difference in me. I'm growing clinically, and I'm thinking as a clinician, and I'm thinking about my patient, and my heart is in the right place, and I'm just flourishing right now, in case y'all couldn't tell. Oh, also, I have on my Black Girl Magic PD shirt. I told y'all in the very first video, if you haven't watched it, check it out. It's Insight into PA School, Reese Journey to PAC, and this is my nonprofit organization, Black Girl Magic. We focus on the youth primarily, the homeless, and empowering other women of color in the community and young women to go out and seize the day and accomplish their dreams. So if you're interested in the shirt, please hit me up below, send me a message, and support. And other things that's going on with me, I just released a promo video for my book called Unfold My Ashes, Silent Tears That Became My Rebirth. That's dropping in the fall. You can pre-order my book on Amazon and Kindle ebook on September the 14th, guys. I'm so excited. Please support me. This book is for the girl who thinks that she just has so much trial and tribulation, she could never follow her dreams, she could never be, nobody would take her seriously. For the girl who might have been a part of the Me Too movement and thinks that nobody believes her or doesn't believe in herself, her beauty, her worth. For the girl who has low self-esteem and low confidence, this book is for you. I wrote this book for you. So please, if you have any questions regarding my book, hit me up below. If you have any questions as far as PA school goes, hit me up below. Got something you want me to make a video about, just contact me. And until next time, I guess continue to strive for your dreams and don't let nobody tell you that you can't. I will be going to pediatrics, so I'll be with the babies next month. So of course another video will be coming for you guys in another 5 weeks. Until we meet again, this is Reese. I'm signing off, and y'all keep me in y'all prayers. Have a blessed one.